Hey, everybody, welcome to WCA Extra. This is our live desk streaming show that kicks off every day around 9:15. It's 9:30 now, so we're a few minutes behind this morning. But I'm just going to get in the horn today to talk Vermont hospitals, a lot of Vermont hospitals, kind of getting the green light on some new spending. With that in mind, our Calvin Cutler covered this yesterday, kind of fills us in with what we can expect today. Calvin, good morning.
Yeah, good morning, John. Thanks so much for having me. I mean,
Yeah.
certainly the hospital budget process, is something that the Green Mountain Care Board, who was created maybe about 10, 15 years ago, to implement single payer or to oversee single payer healthcare. They now are in charge of regulating hospital budgets and approving those budgets and commercial insurance carriers and rate increases for them. And really, what we've been seeing in recent years is just across the board in Vermont's healthcare sector, costs have been really spiking, really ever since the pandemic.
Yeah.
And Vermont hospitals collectively, there's 14 hospitals, and then three within the University of Vermont Health Network,
Yeah.
including University of Vermont Medical Center. Across the board, they had requested about 8% increases on average, but state regulators on Friday approved about 4.1%, which translates roughly into about $150 million in new healthcare spending. And, if you look at healthcare as being a business perspective, bringing in more revenue, growing their business, in theory would be a good thing. But when you
Yeah.
look at actually who pays for healthcare, that goes into either your out-of-pocket costs, paying for your procedures, or that gets translated into increased healthcare premiums for private insurance. So I think there's definitely costs have been continuing to spiral, and
Yeah.
there's a real concern about affordability here.
Yeah, and you bring up a good point. No, I guess really, or mainly was going to ask you is what is on a lot of people's minds is who is that trickling down to? But you really just kind of dotted that there. But with, I guess my next part is, looking through your story, what are those driving factors that is causing that to jack up? I know we saying ever since the pandemic the cost of healthcare is in general skyrocketing, but more specifically. You know what I mean? Like what are those specific drivers?
Yeah,
That are
what's
that?
the cause, right? And
Yeah,
and there's a number of factors, and it's tough to pin it on one specific one
yes,
in one specific cause. But when you look at hospital spending and the hospital budgets, anywhere from 60 to 70% of a hospital's budget is comprised of staffing costs, whether that be support staff, custodial, janitors, cafeteria workers,
yeah,
to nurses, traveling nurses. That's been a
yes,
huge,
yeah,
we've been paying traveling nurses a lot in many of our hospitals. And then also executive salaries and administration. That's part of it too. So I think the traveling nurses part, though, really can't be understated. We hear from time and time again from, some hospitals and from employers like UVM that are saying that they can't recruit workers, or they do have workers and or nurses, in the pipeline ready to move to Vermont out of medical school, but they are unable to find housing here, and so because of that, they have to turn down the job, and
yeah,
we have to continue to turn to traveling nurses. So the labor portion of it is a really big factor. Inflation is also, hitting electric bills, medical supplies. I mean, you name it, really, inflation is hitting a lot of different things within operations of hospitals. And then there's other, bigger picture, challenges like pharmaceuticals and prescription drugs. That's something, from the federal government's perspective too, that those costs are really high. So really, it is somewhat of a perfect storm that we've been seeing. But state regulators are, every time we try to they approve these budgets, they're trying to balance, access, affordability, and quality for the hospitals, because you want hospitals to stay solvent, you want them
yeah,
to stay in business, but you also don't want to price people out of the market, because the question is, if healthcare gets to a certain point where it's too expensive to either get primary care or get a specific
Yeah.
procedure done, people will either take on medical debt and be paying lots of interest on that debt, and that's not good for people either. Or the other alternative is they forego that care, don't get that surgery,
Right.
and then it gets worse and worse, and
Yeah.
then you find yourself in the emergency room or having to get transported via ambulance or life flight or what have you,
Yeah.
and that's even more expensive too, and that's a really negative outcome. So it really is somewhat of a really challenging spiral that the state is trying to get itself off of.
Yeah, and it's I like that's saying the perfect storm there. I guess outside of the more of the doom and gloom, what steps, if any, that the state doing to get out of this rut in any capacity?
Well, it's a great question, and there's several fronts
I mean, it is
that
just that.
state lawmakers have been trying to really tackle this.
Yeah.
Number one, and really this is in no particular order here, but housing is a huge portion of this, as I mentioned, trying to recruit people and to grow our workforce, grow our demographics. There was the Homes Act, which lawmakers passed 2 years ago. There was the big Act 250 sort of conservation bill that is a land use bill they hope will spur more development and more housing. So that's kind of what's being done on that front. In recent years, there's also been more, incentives and loan relief programs for medical workers and nurses and others to try to spur Vermonters to stay in state and to seek nursing and other, medical licenses and stay in the field. And the other, kind of two-part conversation that's happening. We've reported a lot on the all-payer model, which seeks to basically flip how healthcare is paid for by pooling Medicare, Medicaid, and private insurance and funneling it on a flat monthly basis to providers. So primary care is incentivized. They're continuing with that model. It's now called the AHEAD model, where they're now paying hospitals and providers with global budgets. It's basically fancy speak for saying flat monthly payments.
Right.
And the other piece, and we're actually going to get this week, is Act 167 started the work about hospital sustainability, which is there's been several key consultant reports, and there's another really big one coming out on Wednesday, which will take a look at, in a state with a declining demographic, we have older Vermonters utilizing more services, the cost of those services are increasing. How can we better use and how can we better design the physical footprint of our hospitals and what services they offer in the most efficient and effective manner? We have 14 full-service hospitals, essentially. Some, offer more specialized services than others, but there is a real question of, does North Country up in the Northeast Kingdom need to be offering all of the services, or what should Northwest Medical Center in St. Albans be offering compared to Brattleboro Memorial Hospital, or et cetera. So that's also a really long simmering conversation as well about should we have 14 full service hospitals? What should that look like? Again, no easy answers here, but this is work that's going to be happening within the Green Mountain Care Board and the Agency of Human Services.
Yeah, absolutely. And I think, again, you said it earlier too, it's just like compounding issues one on top of the other, how housing is tied into this and everything else like that. But Calvin, we'll share that story in just a sec. I know I've talked to you out this morning, so I appreciate you coming by. And again, of course, we'll do the thing for on Wednesday. Of course, we'll be on top of that as well. So, Calvin, thanks so much for coming by and shed some light on some stuff.
Thank you very much, John.
All right, thanks. That was our Calvin Cutler there. Kind of, again, just shedding some light on some recent changes to healthcare across Vermont. He can speak more eloquently on this than I am right now. So I pull this up in just a sec.
State healthcare regulators have to approve hospital budgets, balancing affordability, access, and quality. But really, ever since the pandemic, the cost of healthcare in Vermont has continued to skyrocket.
This year, more than ever, was really the challenge of balancing affordability and sustainability were as difficult as ever.
Healthcare regulators gave the green light to bigger hospital budgets, increasing by about 4%, about half as much as what hospitals requested. The spike in spending, driven by inflation, the cost of traveling nurses, executive salaries, prescription drugs, and more.
We're in a situation where there really aren't many additional healthcare dollars to devote. We're seeing school budgets strained because of healthcare costs. We're seeing state budgets strained because of healthcare costs.
When hospital budgets go up, Vermont businesses and consumers pay the price through health insurance premiums and out-of-pocket expenses. Healthcare continues to be a major concern for affordability.
We have an aging population, but we've seen increased demand or pressure on access, and increased acuity for those patients. So it's quite a balancing act.
But this year, 2 hospitals were dinged for making too much money. Regulators say UVM Medical Center and Rutland Regional Medical Center exceeded a revenue cap and will allow commercial insurance companies to pay the hospitals less. In a statement to Channel 3 News, UVM says despite taking in more patients to reduce wait times, they did not make a profit, saying, quote, UVM Health Network's overall operating margin for FY23 was 0.1%, far below the threshold considered healthy for a nonprofit hospital to continue investing in its people, equipment, and facilities to provide high-quality, cutting-edge care. In recent years, the state is taking a number of steps to bring down the cost of care, including shifting how it's paid for and taking a hard look at the physical footprint of our hospitals. But all parties agree creating more housing and growing our workforce is a key way to bring down the cost of care.
And I think there's many symptoms of a flat economy that impacts many sectors of Vermont.
Unless we address demographics and housing, we will continue to see extreme difficulty in healthcare as well.
Now, part of the solution here as well, regulators say, is making sure our healthcare system and the services that they offer is efficient. So this Wednesday, a key consultant will be offering recommendations to the Green Mountain Care Board about how to make our healthcare system sustainable going forward. Reporting in Burlington, Calvin Cutler, Channel 3 News.
Yeah, and that was Calvin Cutler's story on some changes in healthcare around Vermont. You can check that out on WCAX.com. But for now, Peter, I know we're just days away now from beginning of fall. It doesn't feel like that. At all. Does not
It
feel like
definitely does not.
No.
Yes, yesterday almost felt really like a summer-like day out there. We had all that sunshine. Temperatures here for most of us were in the 80s yesterday. Today, basically more the same. The one thing I will say is you can see it here on satellite radar as well. We are gradually talking about a few high, thin, wispy clouds kind of filling in here on satellite radar. But that's going to stick around here as we head through the course of your day on this Tuesday. What does that do? Not a whole lot. We're still talking a good amount of sunshine, but probably knocks down temperatures a degree or two here as we head through the rest of the day today. You can see from Burlington, Newport, Rutland, Middlebury, just a few of those high, thin, wispy clouds out there, and we're going to keep that going here as we head through the rest of the day. Temperatures right now climbing through the 50s, back towards the 60s, and most of us will find our way back into the mid and upper 70s and lower 80s here as we head towards this afternoon. Here's how the day shapes up on Futurecast. Again, talking about those high, thin clouds in place here through the course of the day today. Kind of a similar situation into your day on Wednesday as well. Again, not definitely gray and cloudy by any means, but just a few high, thin clouds out there through the course of the day tomorrow as well, and that's going to gradually have an impact on what our temperature is too. Today, most of us generally going to talk temperatures, might as well say upper 70s, lower 80s. Basically more the same tomorrow, but then notice how as we head towards Friday, temperatures fall back into the mid and upper 70s for Friday, back into the lower 70s for the weekend. That's as a backdoor cold front begins to approach the region. That will also knock down our dew points as well. For now, dew points generally in the 50s, lower 60s. Once we start talking dew points in the 60s, definitely not oppressively humid by any means, but it does become a bit more noticeable. But notice that Friday, Saturday time frame, we begin to tick back down into the 50s, then into the 40s. That's as that backdoor cold front makes its arrival. That same cold front could spur up a few rain showers here and there as we head into the day on Friday. First day of forecast here through the rest of the day today. Yep, another sunny, dry, quiet day out there. Daytime highs generally mid to upper 70s and lower 80s. Plenty of sunshine over overhead, but again, some of those high, thin clouds as well. Tonight, overnight lows, they fall back into the 40s and 50s. Mainly clear skies overhead. A few areas of fog starting to develop once again as we head into tomorrow morning. For the rest of your day on Wednesday, most of us again find our way back into the upper 70s and lower 80s tomorrow. Again, plenty of sunshine, but again, a few high, thin clouds here through the course of your day on Wednesday as well. Mixture of sunshine and clouds here for the day Thursday. We have that backdoor cold front that begins to make its arrival as we head into the day on Friday. That could produce a few spotty rain showers here and there. Again, most of us probably will stay primarily dry. Into the weekend, more sunshine. Temperatures, though, a bit cooler. Most of us will talk temperatures generally in the upper 60s and lower 70s. That's closer to where we should be for this time of year, so actually feeling a little bit fall-like here for the first day of fall on Sunday.
Yeah, look, we're getting there.
Yep.
All right, it's a slow process.
Yeah, exactly. I think what we would say for what we saw, just last week, this week, kind of a second full summer, if you
Yeah,
will.
absolutely. And I think the thing is, for people who are really, I guess, anxious for some of those fall activities, they're still out there. I mean, orchards are open. I mean, a lot of people are farm stands getting their gourds and their pumpkins out and all that, so you can still do that.
And the colors are really changing quite quickly for a lot of places, especially in those upper elevations. We're already beginning to appreciate moderate foliage in some spots, especially in the upper elevations. So
No, we're getting there.
yeah.
Anyway, thank you, Peter. Thank you guys for watching WCAX. Of course, you can see Peter and I again on Channel 3 News at noon. All of our content on WCAX.com. Until then, we'll let you guys go and see you at noon.